Hey, I'm Dr. Sorin, and I'm here with Dr. Scott Porter, a pharmacist in Sandpoint for many, many years. And tell me a little bit about your educational background as we get started.
I have a bachelor's degree in pharmacy, doctorate degree in pharmacology, and then with functional medicine, I've studied it over the last 15 years. Um, I have family with autoimmune disease. I got intrigued on looking at the underlying cause, which led me to pursue different avenues versus Western medicine. So it's lots of coursework over the years, and I just grown to um, like that avenue. So it's something where I can do Western medicine and functional medicine. I've been doing it now for 15 plus years.
I love it. So, yeah, you've been a pharmacist for a while. Did your dad start
My
this
dad
pharmacy?
started this business in 1973.
Wow.
I moved back home in 1999. So I've been practicing pharmacy for about 25 years.
Wow, that's awesome. Well, I love what you're doing because I think one of the issues I see with Western medicine, as I've said, has like the best technology if you get sick.
Correct.
Got the best drugs, the best equipment, and all over the world. But what I love about the functional medicine side is I think, as you got these fruit bowls here, uh, diet, lifestyle, those things can play a huge role in
Absolutely.
preventing disease. So
Absolutely.
that's what I'm super excited about because they talk about 80% of people. Everybody's concerned about this COVID virus, and 80% of the people that get it don't need any interventions, whereas that 20% need the hospitalization. So that's what I want to talk to you about: is how can you boost your immune system, because that's really what makes the difference between that 80 and that 20% is the immune system.
Correct.
So if you're older and you have, immunocompromised, multiple diseases, then you're going to be more likely to get in that 20%. So,
Yep.
so let's start talking about what are your recommendations for avoiding viral infections?
So we mostly focus in on here on our nutrition center, starting out with foundational support. So I have a list of like 6 products that everyone should be on for immune support, foundational support. It always starts with a probiotic. This is a probiotic. It's got 4 products in one, probably our most popular. So we start with that, along with vitamin D with K. So these 2 are probably our mainstay products that we use for immune support. They say immunity is like 60% derived from your gut.
Mm-hmm.
So we always start with the gut.
And if I can just make a couple comments on these, some of these conferences I've been to talk so much. This is like a revolution in medicine. We've discovered how powerful the gut is, and I think
Yes.
people underestimate that. So what does this do specifically?
This is going to Probiotics aren't necessarily going to change your gut. I mean, you have like 300 trillion gut bacteria. What they send is signals. They send signals to the bacteria to start replicating, because there's competition going on, and that competition, you have die-off, and then you have inflammation, which causes leaky gut, which causes autoimmune disease, which causes disease. So the probiotics help send signals to produce beneficial gut bacteria to help with some of this competition, get rid of the bad bugs that are in there. It could be as well as yeast as well.
Okay, so that's that one. And then vitamin D. I think everybody that lives, we're in Sandpoint, Idaho, so everybody that lives this far north, I think, needs to be on a vitamin D supplement, because you just can't get enough from your skin the way you're supposed to in the wintertime, especially.
Yeah, not only that, vitamin D is also antibacterial and antiviral, and most of us are lacking it. So it's like, to me, this is essential, and it's also good for gut health. So we always start with probiotic first, vitamin D second.
Okay.
Third product we do is magnesium. 60% of the Western world is magnesium deficient. So this is here there's 10 different forms of magnesium. I have magnesium glycinate, works more in the tissues, less on the gut. So people with constipation, I would recommend magnesium citrate. This one right here has penetration into the brain and into the tissues. It's good for, all chemical reactions, cramping, whatnot. So we always choose magnesium as our third product.
And it's, for those who know, it's a natural muscle relaxant. I'm an anesthesiologist, and you use magnesium if somebody's having contraction. If a woman's in labor, use magnesium to slow it down. And I know it works because when my wife started having early contractions, we put her on magnesium and it just stopped it. It was amazing.
Yep. So then moving right along, our fourth product is a good multivitamin. This one here is got extra B's in there. Most people have methylation problems, which is their body's ability to detoxify. So this is, we always choose a good multivitamin with methylated B vitamins, have a little extra calcium in there. Most people aren't getting that from their diet. So just a good around multivitamin is fourth on our list.
Do you have vitamin B somewhere on there? Somewhere else, or the B's are coming from
The B's are in here. If we were to figure out that someone did have methylation problems, then we would add in just extra methylated B vitamins, because you're gonna have to take like milligram dosages of that, and you're not gonna get that in a standard multivitamin.
Because that's one I take for my family, because we're vegan for the most part, and so it's really easy to get low on B12 on
Exactly.
Because the way you're supposed to get B12 is you from bacteria in on your food. So if you pull a carrot out of the ground and eat it, it's got a little bacteria. But since our food is so cleaned and radiated, that even your vegetables don't have that anymore. So I'm a big fan of the B, especially B12.
Well, the B12, most of the B12s that are in multivitamins is cyanocobalamin. If you have methylation problems, you cannot convert the cyanocobalamin. So therefore, we recommend methylcobalamin or hydroxycobalamin.
I've heard that.
Adenocobalamin.
Yeah.
It's highly absorbable. In fact, we routinely do give that as injections as hydroxycobalamin, not cyanocobalamin.
That's a good tip, and I know the one we have is hydroxy cobalamin.
Highly absorbable. All right, so the fifth product on our list is omegas. Why do we choose omegas? Our diet is so loaded in omega-6s, that's pro-inflammatory.
And the omega-3 is anti-inflammatory.
Exactly.
So you gotta balance those guys.
So that's why we're doing this. We balance out the omega-3s with the omega-6s. Most people don't know what fish oils do. I mean, it's an anti-inflammatory product. It doesn't do anything to lower cholesterol, blood pressure, but it does work as an anti-inflammatory. That's why I recommend this.
Absolutely, and I think part of all this goes to our Western diet, because when you eat a lot of sugar, when your body metabolizes sugar, it pulls a lot of other nutrients out, so that's how you deplete it. If you eat a fruit, it's got all the nutrients there with it, but when we just take the sugar out of the fruit and just eat sugar, then your body's using up all these nutrients in order to handle our processed sugar that most of us probably eat too much of. So and same with our the omega-3s and 6s. I know a lot of even super healthy people that end up eating a lot of processed food that's high in omega-6s have inflammatory problems, and people forget that heart disease is an inflammatory disease.
Yes. Yep.
So if you can have inflammation inside your blood vessels, so if you can knock that inflammation down, you reduce your risk of a heart attack.
So we recommend the triglyceride form. It's most fish oils are ethyl ester. It's inferior absorption. You get a triglyceride form. It takes 2 extra processing steps, costs extra money, but it's 70% more absorbable than the ethyl ester form.
And just out of curiosity, do you have a non-animal based formula of omega-3?
Yes, we do. We do flax. So we have algae and flax.
That is so cool, because I put flaxseed in my smoothie every morning, so that's awesome. My source.
Okay. Last product on our list of essential nutrients is digestive enzymes. Most people, including the elderly, they have low stomach pH. This low stomach pH leads to malabsorption. With malabsorption, you have inflammation. You're at higher risk of contracting viruses, bacterial infections. So digestive enzymes, they help break down food. It's also another anti-inflammatory product. So we typically use one that will put acid in the stomach, as well as break down emulsified fats, protein, carbs, plant-derived products. So highly beneficial.
That is super cool. All right, so this is kind of your core, and
This is foundational.
from a lot of what you
This is
said,
foundational.
since I do pain management, a lot of this has to do with decreasing inflammation.
Yes.
And so this obviously would help people with arthritis type of pain or any sort of inflammatory problems. I mean, there's so many, even autoimmune diseases that create inflammation in joints. So this is foundational. So let's talk specifically. I think you and I on the phone, we talked about specific things to help reduce your viral infections like zinc, quercetin, those types of.
Yeah, so I would. There's 4 main ones that we could talk about with reducing the viral spread and inflammation. It's going to be resveratrol, antioxidant. It's going to be quercetin. It's going to be green tea is another one, and then curcumin would be the 4. All these supplements treat inflammation, and they help with viral spread.
Yeah. So let's go over them a little bit more slowly. So what was the first one you said? I'm sorry.
Let's take quercetin right here.
Quercetin. I know my sister-in-law did all this research because everybody was trying to get the hydroxychloroquine when they came out with the info. How does this work?
So quercetin, research is showing that it can be functions similar to hydroxychloroquine as a positive ionophore.
So this is an over-the-counter form. So everybody's, they know that even our Idaho State Medical Board put out a limit on doctors prescribing it. But quercetin works in a similar way. It's over-the-counter supplement.
And it's found in apples.
Cool.
One apple's got around 20 milligrams. The dose that you want to take of quercetin is about 500 to 1,000 milligrams for it to be a benefit.
One more reason to eat apples.
I tell everyone, start eating apples at least. I mean, who doesn't like apples?
Hey, we live in the Northwest where apples are grown, so.
Exactly.
Okay, that's actually great. What about, just out of curiosity, apple juice?
Well, you're dealing with the sugars.
That's the problem, because that's what I tell people. You get rid of all the fiber and you pull out all the sugar, which tastes great. But, and especially the store-bought stuff that's pasteurized and stuff.
Apple sauce, probably the same way.
Yeah.
Okay. Just regular
apples. So quercetin and eat a real apple.
That's right.
Okay.
Yep. Another one, this is like green tea. This tea right here is a potent antioxidant, potent antiviral. You don't necessarily need to take it as a supplement. You can drink green tea. The research is showing 4 cups a day of green tea. And that would be without the caffeine.
Yeah, I was going to ask you about the caffeine because I'm not a huge fan of the caffeine, but I know green tea.
So this one here is called ECGC. I believe it's the fractionated form of green tea, totally caffeine free. It's extremely potent as an antiviral.
Cool.
But it's better. It's more beneficial to drink the tea than it is taking a supplement. It's whether or not you can stomach drinking the green tea.
Well, okay, that's great. Let's talk. What else you got there? Zinc.
Zinc right here is a mainstay right here. This is antiviral. It helps prevent viral shedding. Very important.
Right, because zinc we've known for years that all the little cough drops and stuff, a lot of them for preventing colds have zinc in them because we know zinc kills viruses.
Correct. Dosages right now with the coronavirus, 50 to 100 milligrams. You don't want to go too high on zinc because you can get toxic, but they do say the virus, the first thing it does is deplete the body of zinc. So when you lose zinc, you can lose your sense of smell, taste. So they're saying, well, you could have the coronavirus once you lose the sense of smell and taste. So I've been recommending people buy some fresh flowers and smell them. And if you can't smell the flowers, maybe eat something. If you can't taste that, you better watch your temperature.
Well, that's a good point. Plus, it'll brighten you up, and that'll boost your immune system because you'll be happier. Your wife will be happier if you buy flowers on a regular basis. Vitamin C. Let's talk about that too. That's one that's been talked about for a long time.
Mainstay. I mean, they're even using this now for vitamin C infusions, like 3 to 6 grams every 6 hours for treatment of COVID.
Do you know much about that?
I don't. I've heard about it. I don't know if we can do vitamin C infusions here in Sandpoint. I think you probably have to go to Spokane or.
We could do them at our clinic. We've talked about it. A friend of mine had cancer, and she read about that, and she wanted vitamin C infusion. So I know she went to a practitioner and got it. So it wasn't difficult to do. So
Antiviral, antioxidants mainstay. 2 to 3 grams a day is what I recommend.
that's right, and it's water soluble. So
Yep.
how much is in this one? How many grams are in this?
There is probably 500 milligrams. I prefer the liposomal vitamin C. It's kind of wrapped in a fat, gets absorbed a little bit better. No
That's
GI
right.
symptoms. The problem is it's very hard to come by because everyone's buying it up. So we have we sell a lot of liposomal vitamin C liquid. A little bit goes a long way.
Let me ask you a question though. Then you could counteract that by just taking more of the regular vitamin C.
You could, but you're running the risk of getting diarrhea, upset GI symptoms. Buffered vitamin C.
So, but if you got an IV, then you would go around all that, the GI symptoms.
I would believe so.
Yeah.
Yes.
Yeah. Okay. Cool.
All right. Another product, antiviral, is vitamin A. So vitamin A also helps with the with lung tissue damage caused by the viruses. A lot of the elderly they've done autopsies on them that have shown where they've died from the coronavirus, they've had like really, really low vitamin A levels. So I recommend vitamin A to help protect the lung tissue. Not only that, it's antiviral.
Vitamin A. Now, so A, D, E, and K are the fat soluble ones. So you can overdose on vitamin
Easily.
A and vitamin D and vitamin K.
Yes.
So let's talk a little bit about dosages, just for.
You want to, yep, okay. So if you're sick, typically, just for a really bad cold, we would recommend 150,000 units for 3 days only.
Of vitamin D.
Of vitamin A.
Of vitamin A.
150,000 units. Vitamin D, typical dose recommendations, 50,000 units a day for 3 days. It's a high dose, but you hit it hard because we want to ramp up the immune system, get rid of the virus. So it's 50,000 units of vitamin D. We do 150,000 to 200,000 units of vitamin A.
By mouth or a shot?
We do it orally.
Yeah.
Yeah, orally. I can't. I mean,
I've heard that a lot from people that you can, and I've tried it myself, where you just take large dose. You feel yourself starting to get sick. You take a huge dose. You slam your body with it, and boom, it just boosts your immune system.
within 3 days.
So 50,000 units of vitamin D for 3 days.
For 3 days, 150,000 to 200,000 units of vitamin A for 3 days, and then back it off. Right now, you don't want to do anything more than about 50 to 100,000 units for just short periods of time, then back it off. Otherwise, you can.
And then what do you recommend? Because I recommend vitamin D to all my patients. Everybody that lives up here. If you don't go to Costa Rica or Arizona for the winter, I'm telling people. But by the way, I used to work in the desert, and I had a doctor friend, and he used to, a neurologist, and he used to test people in the desert in California, in the sunniest place on earth, and they'd be low in vitamin D because it was so hot. People don't go outside, so. Vitamin D is a big one.
Well, if you put sunscreen on, you're blocking the benefits of vitamin D too.
That's a good point. So you're fighting the dermatologist on
exactly. That. So it's like, I mean, I tell people obviously wear sunscreen, but if you can go outside, cover yourself up, get like 15 minutes exposure of sun, you're going to get your 10,000 units of vitamin D from the sunshine. So what do I recommend? 5 to 10,000 units a day.
And okay, that's great.
With K.
With K, and explain to me the K, the importance of the K.
The K helps drive the D into the tissues along with calcium. It's most people that are D deficient are also K deficient. K also helps with you becoming toxic on vitamin D. So it's very hard. It'd be very hard to get toxic on vitamin D if you're taking it with vitamin
with the K.
Yes.
And you just mentioned the calcium, because that's a big deal as people get older. Vitamin D is very important for your bone strength.
Yep.
And obviously with calcium. So a lot of people with osteoporosis, you recommend
vitamin D with K plus calcium. Absolutely. And you use some magnesium too. I mean, magnesium helps with the absorption of the calcium as well.
Love it. Okay.
Okay, so final product that helps with the viral activity and spread is a product called Curcumin. This comes from the plant turmeric. It is an anti-inflammatory. Of all the products that we sell back in our nutrition center, curcumin is our #1 seller because everyone that comes in has got some inflammatory process. So we use it to treat inflammation in the gut, joint tissues, brain health.
So it helps
highly
with gut
beneficial.
inflammation.
Correct.
That's
Yes,
funny.
it helps heal the gut.
So can you take this on an empty stomach?
I take it daily on an empty stomach.
Okay, because I didn't
Yes.
know, because turmeric, when you taste it, it's pretty strong, so I didn't know if it'd
Exactly.
be hard on your stomach.
Well, what you cook with is not absorbable. It has to be, you have to get it across like the brush border of the gut. So with this particular product, it's wrapped in a fat, similar to a phytosome complex. So you get rapid absorption. There's other preparations with black pepper. Black pepper actually causes inflammation in the gut. So it opens up the gut a little bit, so the curcumin can get absorbed. But it is causing inflammation, which typically isn't what you want.
Okay, so this one, so what kind do you recommend again?
I would recommend one that has a phytosome type complex, so it's wrapped in a fat. You're going to get 30% better absorption with that than you will with a curcumin product with black pepper.
Okay, and it's not going to harm your gut because we're fighting the gut here. We're trying to.
This is
optimize
actually
it.
going to help heal the gut. So it's and not only that, it's a potent antioxidant and it's a potent
That's right.
antiviral, and it helps with the activity of the virus. It lessens viral activity.
Cool.
Very important product.
Okay, so then just kind of in review, if somebody can't afford or doesn't want to start with all these, what like 2 or 3 or 4 products would you recommend as your top ones here?
I would start with the foundational. I would go with the probiotic, vitamin D with K. That's 60 to 70% of your immune system right there. That's what I would go with.
So if you're not doing that, that's something you highly recommend.
I'd recommend these 2 products definitely. Magnesium, though, I mean, would be 3rd on the list. Otherwise, as an antiviral, I would go with vitamin A. You can get vitamin A from animal meat, but if you're vegan, you could be lacking vitamin A. So then I would probably go with some vitamin A and then just vitamin C.
Okay, love it. So I'm doing most of those. The vitamin A I probably need to get on. This has been educational for me, so I really appreciate your knowledge. Just real quick, kind of in closing, tell me about your store, the address, phone number, and you guys do home delivery? Jump into all those, I hear.
Okay, so we're doing curbside delivery right now. This is going to be the future. So it's real convenient. You pull up in our parking spot, you call us, you give us your credit card, or we can take cash, check, whatever. You call us, we will bring the product out to you. A lot of people are sick, or they don't want to come in where there's crowds of people. Not like we have crowds in our store, but we do curbside deliveries. We do in-town free deliveries.
I've heard that from patients. So
We've
a lot
been
of
doing
my
that.
patients
Yeah,
love
we've
you.
been doing that for 35 years.
I didn't know that. So
yeah.
patients just told me that you guys deliver, and
Yeah,
so a lot
deliver
of my
right to
older
their
patients
house.
don't want to go out. They love
Yeah,
it.
call us up, we'll deliver it. If it's something where if it needs a special delivery, we'll go out 3-4 times. We're mailing out more prescriptions.
So you even mail prescriptions out.
Yes, yeah, we mail out a bunch. We've been here at this location since 1983. I mean, we're right next to Safeway on 5th Avenue. In fact, our address is 604 North 5th Avenue. If you see Safeway, we share the same parking lot with them. I have a huge parking lot, easy in, easy out. The parking's free too, which is nice.
There you go.
So,
And your website?
our website is just sandpointsuperdrug.com. We're open every single day, Monday through Friday, 8 to 8. Saturday, we're 8 to 6. Sunday, 10 to 6.
You have some of the best hours in town and the most convenient, so that's why when I've needed stuff, I've come here.
That's what it's all about.
So, well, we really appreciate you taking the time to give us your expertise, God. So thank you so much.
And I appreciate you having me on, Sorin.
Thank you.
Thank you.